The time to study for the practical. Okay, so if we have the ventilation that's occurring, if we have these factors that can affect it, one of the ways, that we use to measure the pulmonary function is spirometry. So this would be a measure of our ability to breathe. Y'all ever seen one of these? How? Where?
My great grandma had one.
Like at her house with her? At her house? And a lot of times people who've had to undergo surgery, you might see it with them. If they're in the hospital, maybe pneumonia, bronchitis, whatever the case might be. Okay? Then you may see this. And the term spirometry is telling us that how they're measuring, okay? They'll take the numbers that get collected. You can see these different volume numbers on here because one of the things about the breathing process, it talks about volumes of air, okay? So they take the numbers that will show up as the little, the little, sometimes it looks like a little ping pong ball, whatever the case might be, okay? And as it moves, they'll measure the numbers where it lands. And they will take those numbers and put them into their calculations to determine that person's function of their lungs. And so they do this because, people who have had surgery, they want to make sure that, their lungs are back to proper function. People with respiratory diseases, people who might have pneumonia, whatever the case might be, they're trying to check and see if the diseases or the illnesses are progressing or not. So what it does is it recaptures the expired breath. It'll help determine what's the rate and depth, what's the speed, and therefore they can determine oxygen consumption. They can take those numbers that they get, put them into their calculations, and give this information. Like I was saying, numbers are based differently, so be sure to check out your textbook as it will give you some numbers that they look at and what fall into normal values. So when they're looking at their numbers, like I keep saying, it's measured based on volumes. They talk about a volume of air, meaning an amount. So it gets really interesting, the terms that they use with air. Well, when they say, what is the amount of air inhaled and exhaled in one cycle, they call that tidal volume. I don't know why, okay, but they do, all right. At rest, the numbers, like I said, there's a list, okay. Numbers fall for this amount at about 500 milliliters. That's what you would see moving up and down that little tube. But then, well, we have what's called an inspiratory reserve volume, meaning what could be inhaled after the norm. They say that can be up to 3,000 milliliters. That's a lot of air, all right? A lot of hot air. Y'all now know why, right? Okay? You're like, oh, that's just a lot of hot air. Because now y'all know that the air that made it to the lungs, okay, had to be warmed, all right? And then, of course, coming back out in the form of talk and everything, that's a lot of hot air. Okay. All right, so the expiratory, all right, what we're breathing out. What is it that can be breathed out after a normal exhale? People who had like that little spirometer thing, okay, Well, what's one thing they tell them when they're using them? They're like, oh no, breathe out more. And so they got that little tube and they're like, okay. And that's a number that they're looking at. They're trying to see how far that goes. So they would say, oh, okay, we got a value for that. And then, okay, what can stay in the lungs? Now remember, we've got all these different spaces that are available, okay? So they're saying there's an amount for how much can be in the lungs after that respiratory cycle. So they have their math. And like I said, your textbook's going to get into great detail about that. I will not ask you to do math on this. Okay? I will not ask you to do math. Now, if you're going into respiratory therapy, that's going to be different, but you're going to learn that. Okay? You're going to learn that in first class. So, a capacity. Now, don't get me wrong. This is very important. Okay? Because this is what the respiratory therapists and the doctors and the people who are treating an illness or a disorder are going to be dependent upon. They are going to be dependent upon these numbers. So, what they say, it's the sum of two or more of these volumes. Okay? So, if you had values for any of these, you simply plug them in and do the math. And that's what a respiratory therapist would do. They would get that little spirometer, get their numbers, take their values that they know, insert numbers that they collected, and put them into their math to give the caretakers what they need to know. Does that make sense without making you all do the math? Okay? So, they will have norms for all of that and they will do the math.
I'm sorry, so do we need to understand, like, know the actual equation? Like,
Be familiar with what a tidal volume is. I'm not going to ask you to know 500 milliliters. Just be sure to understand the amount inhaled and exhaled. Okay. Inspiratory, that goes beyond a normal, that sort of thing. I won't ask you the numbers.
Okay. But I'm saying, like, vital
this
capacity.
Right here,
yeah. Do we need
I will
to
not
know?
ask you to do the math.
No, I'm saying, but do we need to memorize, like, the actual equation? No? Okay. All right.
Yeah. No. But understand that we do have capacities.
Okay.
Okay?
All right.
And if you look at it like inspiration, the residual, total lung capacity, we do have these capacities and they're dependent on the numbers that got collected.
Okay.
Okay? Capacity is going to let them know the lung capacity will let them know, for example, if they are on oxygen, so maybe somebody at their home, how they might have that machine that's producing the oxygen, and they may need to turn it up or turn it down. If they're in the hospital, the little thing that's connected to the wall, they may need to turn it up or turn it down based on the numbers that are collected. Does that make sense? Okay. So, when we talk about lung disorders, because those numbers, those values are going to help them determine if, first of all, could there be something wrong? If there is, we need to start investigating to find out what could be wrong, okay? And then if there is something wrong, what do we need to do to treat it? Okay? So, when we talk about disorders, we're going to say that lung disorders can either be restrictive or obstructive. Restrictive, think about a restriction that could be present. Could that be something wrong with the thorax? Could that be something wrong with the lung tissue itself? Okay? Restrictions, restricting the movement of that lung tissue. If it's restrictive, it reduces my pulmonary compliance, meaning the expansion and recoil of my lung tissue. It limits the amount of inflation that can take place. There might not be anything at all present at the area of that respiratory membrane. Meaning, there may not be anything wrong at this point, but the person has breathing problems because of a restriction in the anatomy. Does that make sense? Okay. If it's restricted, if it's a restrictive disorder, vital capacity will be incorrect. If we look at vital capacity, those numbers will be affected if it is restrictive. Good examples: black lung disease, people who are coal miners, TB, tuberculosis, okay? Those are good examples of restrictive disorders. If it is obstructive, something is blocking or narrowing the airway. For example, asthma. Because asthma it basically comes in and the muscles tighten, and therefore that bronchiole is now obstructed. Does that make sense? This one shows up in forced expiration. So that would help them know. So basically, when they look at their numbers, those numbers help them, it can help them determine if something's wrong, and then what do we begin to investigate, to begin to treat, to help this person breathe more easily. In your textbook, there's information about about different types of disorders that come about based on the respiratory readings. So the goal of respiratory cycle, okay, an inhale and exhale, exchange the gases. All right, so as we look at this gas exchange and then the transport of it, we have in this air around us a composition. We have our nitrogen, oxygen, carbon dioxide, and other gases that are present. The gas laws that we mentioned earlier, they affect what these are going to do at the level of my lungs. And these vary. Like I said, for example, what sea level are we? What atmospheric level, for example? Therefore, Dalton tells us atmospheric pressure will affect those gases. What are my partial pressures? That P that was in the little video, okay? So, based on where we are, the atmospheres that are present, that will basically affect the level of an oxygen, CO2, and all the other stuff that's present, okay? Keep saying this. This is affected by atmosphere. Oh, the majority of it, okay? So, here's what's going to happen. This